Welcome to this presentation on facilitation techniques in RT. The approaches utilized in RT are diverse, and selection is based on several factors, such as the population being served, the treatment goals of the client, the resources of the facility, the mission of the organization, the treatment setting, and the skill set of the therapist. You will want to make sure you have a good understanding of the techniques used in RT services. Leisure education is the most widely used in RT and is appropriate for all RT clients. Leisure education emphasizes leisure awareness, attitudes, social skills, decision-making, activities, and resource development. Leisure education focuses on the development and acquisition of various leisure-related skills, attitudes, and knowledge. Programs have a specific predetermined content, which is operationalized into programs. Leisure counseling includes leisure education, but involves learning about leisure-related information, attitudes, beliefs, and skills. Leisure counseling focuses on leisure attitudes and awareness and generally requires a degree of expertise in counseling techniques by helping the individual to select satisfying and practical leisure activities, assisting clients to find the time and place to enjoy leisure activities. Unlike leisure education, leisure counseling does not start with a predetermined content. Community reintegration focuses on organized activities in which the RT accompanies an individual or group on an excursion in the community. This is a valuable form of leisure education that exposes clients to community resources and assists clients in learning to utilize skills necessary to ensure success in society. Outing examples include going to the parks, bowling, movies, restaurants, museums, shopping, community-based recreational facilities, concerts, and swimming. Creative arts uses the creative process to help reconcile emotional conflicts, foster self-esteem, and personal growth. The purpose of creative arts is to decrease agitation, increase focus and attention, and stress reduction by engaging in the arts can help clients manage pain, alleviate stress and anxiety, and cope with upsetting events. Creative arts include such interventions as arts and crafts, fine arts, visual arts, music, drama, dance, and creative writing. It is important to note that as RT professionals, we may use music and art as a modality, but RT professionals are not art or music therapists. It is inappropriate and inaccurate to say that you are doing art or music therapy without the associated degree. This slide also covers a group of techniques I like to refer to as skill building. These are programs that are designed to help the client learn some sort of new skill, such as games, cooking groups, or hobbies. Hobbies are activities that require concentration and repetition of action, such as knitting, crocheting, and building models. This next slide will cover facilitation techniques I like to categorize as ones that target personal development and insight for the client. Bibliotherapy uses reading materials for a therapeutic purpose. Originally designed to be used with individuals suffering from depression, bibliotherapy helps to foster an understanding of oneself, help to solve therapeutic issues, and provide solutions to personal problems, develop life skills, and enhance self-esteem. Cinema therapy is similar to bibliotherapy, except instead of using printed material, the therapist uses films or music. Movies. The video or movies is selected for its therapeutic purpose and relevance to clients' needs and the purpose to help the client develop insight into their own issues and apply problem-solving skills to their personal situation. Values clarification is a process in which clients explore their values and how these values influence behavior and make decisions to act in accordance with their values. Unclear values can lead to loss of motivation, poor decision-making, and dissatisfaction. The goal is to help clients to make autonomous decisions consistent with their values. Social skills training addresses deficits in social behaviors that hinder the client's ability to engage in effective interactions with others, such as listening skills, taking turns when speaking, controlling one's emotions and impulses, and smiling and nodding appropriately. Social skills trainings can help the client increase self-esteem, improve relationships, and promote self-confidence. Anger management is a specialized social skills area where the client learns to reduce their reactions to emotional triggers and the physiological arousal that anger causes. Ultimately, anger management can help the patient learn to control reactions and responses to triggers and use a variety of techniques to positively manage a situation. Another specialized area of social skills training is assertiveness. Assertiveness training is designed to help clients learn how to communicate feelings, desires, and needs in an honest, appropriate, and straightforward manner. It strives to teach clients how to become more assertive in social situations and develop personal techniques for positive verbal communication. Problem-solving therapy helps individuals develop coping skills to deal with stressful life situations. Effective problem-solving skills has been associated with optimism, hope, greater self-confidence, self-esteem, improved health, well-being, and overall life satisfaction. Cognitive behavioral approaches are based on the idea that a person's thoughts or cognitions dictate how he or she will react emotionally and behaviorally in a particular situation. These interventions are designed to help clients recognize how thinking impacts emotions and to teach them techniques for monitoring and self-evaluating their thinking. Many of the techniques used in RT fall in the relaxation and stress management category. These types include a process by which one retreats mentally from their surroundings by quieting their thoughts and relaxing their muscles, and maintaining a state long enough to decrease anxiety and tension. Chronic stress leads to physical, mental, and emotional overload. Relaxation is a skill that can be learned with practice. This slide lists many of the stress management and relaxation techniques common in RT practice, such as deep breathing, progressive relaxation, and autogenics, which are all meditative in nature and require a quieting and centering of the mind. Guided imagery and visualization use pictures in the mind to promote a state of relaxation. Visualization is self-directed practice, while guided imagery relies on an external source, such as a video or recording, to guide the practice. Biofeedback uses highly specialized equipment to teach people to control their physiological responses to stress. Aromatherapy uses oils and scents to help induce a relaxation state. Other techniques that help to promote relaxation include massage, yoga, qigong, and tai chi. This slide will highlight some of the physical activity, exercise, and fitness-based techniques used in RT. Exercise is an integral part of every RT program due to its widespread impact it has on health and well-being, and it is the most effective means to increasing functioning and independence in people with disabilities. Only about 15% of adults take part in leisure time physical activity for at least 20 minutes 3 or more times a week. Inactivity delays recovery, reduces ability to function, and promotes deterioration of almost every bodily system. Some of the techniques have already been discussed on the previous slide, as they are both relaxation techniques and forms of exercise. These include Qigong, yoga, and Tai Chi. Outdoor recreation includes activities such as hiking, biking, mountain climbing, fishing, and camping. Adventure therapy uses interventions such as ropes courses that include an element of danger to assist with problem-solving, decision-making, and communication skills. Horticulture therapy uses plants as a therapeutic intervention. Assistive technology refers to any service that directly assists an individual with a disability to increase independence and function. These devices typically focus on assisting them in participating in daily recreational activities. Examples of assistive technology include Velcro, adaptive toys, computer hardware, communication systems, enabling switches, virtual reality, video games, and adaptive equipment. Using technology in treatment is very common. This could also include video games, accessing computer applications, robotics, virtual reality, and video production. Snoozle-in rooms are a multi-sensory environment aimed to help individuals with sensory deficit disorders, such as autism and dementia. There are a few specialized programs designed to meet the needs of specific disability groups. Cognitive rehabilitation is only used with individuals with a traumatic brain injury. Cognitive rehabilitation helps with attention, memory, as well as the ability to initiate, plan, organize, and regulate behaviors to assist with neuropsychological recovery. Sensory stimulation, not to be confused with sensory training, is designed for brain injury patients who are in prolonged coma. Sensory stimulation involves providing a number of items or experiences that activates one or more senses in either a multimodal or unimodal design. Animal-assisted therapy was originally called pet therapy, sometimes called pet-facilitated therapy. Animal-assisted therapy uses animals in goal-oriented treatment as a part of the client's overall treatment plan and helps to facilitate a client's progress toward a specific therapeutic goal, such as establishing satisfying social relationships. AAT is used with clients of all ages and in a variety of settings to reduce stress, pain, symptoms of depression, and blood pressure, as well as helping to improve physical functioning, awareness, cognition, and quality of life. Animal-assisted activities, AAA, is different from AAT. In AAA, the goal is to provide meet and greet animal-human interactions to enhance the quality of life rather than a specific treatment plan. The therapeutic use of play is used exclusively with children. Play provides children with opportunities to enjoy themselves and learn a variety of skills. It allows children to experience autonomy and provides them with opportunities to experience success and be in charge of their actions. Play can be used to teach and improve verbal communication, friendship development, coordination, problem solving, and coping strategies. When providing treatment to individuals in the later stages of life, there are several programs designed to meet the unique needs of this population. Validation therapy uses empathetic communication to help clients to regain dignity, reduce anxiety, and prevent withdrawal. Intergenerational programs provide an environment where individuals from different generations participate in programs together to build social connections. Resocialization involves a group interaction process to assist isolated individuals to rediscover their surroundings, potential, and values. Sensory training is a program of sensory stimulus bombardment directed toward the 5 senses, designed to improve functioning. Reminiscence therapy is a structured verbal interaction process of recalling long-term memories, generally with a focus more on positive memories than negative ones. Reality orientation focuses on combating confusion, depression, and apathy. Remotivation therapy is a motivational technique to promote discussions on topics that may bring participants closer in touch with the world outside of the institution. Remotivation therapy is done with clients who have completed a reality